diastole. Notice that in the lower panel, still in the right-hand column, you have a reduced annular equine velocity, and that can help identify these cases as having myocardial disease. Also, in the late stages of diastolic dysfunction, elevated filling pressures, the equine velocity is reduced, as you see in this case. So the next slide will show us how we would identify if diastolic dysfunction is present. A lot of it will come from clinical and 2D data and not just Doppler findings. So I want to emphasize the importance of trying to gather this data. For sonographers, you can go to the patient's charts as well as asking patients. And for physicians, sometimes we have direct access to the patient records depending on the electronic health record in a particular place where you work, and that data should be sought and looked after if not provided by the sonographer. So evidence of known diseases, coronary artery disease, and you may have evidence from the 2D exam for that, for example, wall motion abnormalities. If you identify the presence of pathologic left ventricular heart, if you look at the pulmonary venous flow, you see predominant flow in diastole, and you have a prominent atrial reversal. It's prominent not just in its peak value, but also its duration. When you compare it with that of forward mitral inflow, which lasts for a short time, this is happening because late diastolic LV pressures are elevated, and it is easier for the left atrium at this time to send blood into the veins than forward into the ventricle across the mitral valve. This is a very useful signal. As individuals age, if they have normal diastolic function, atrial reversal does not become prominent as you see here. So if present, it's very useful to tell you that LP-EDP is elevated and there is a degree of diastolic dysfunction. The next slide, we will see another useful signal, which is the valvular maneuver. I will not go into much detail on how that is done. Ms. Deb will cover it, but this is an example from a patient with a big left atrium. During the straining phase of valve, the venous return drops, left atrial pressure drops, and you see a reduced E to A ratio. If you see this finding, this is again specific for elevated left atrial pressure and is very useful. We'll see another useful signal